I am Erin Murphy. I am a registered nurse, and I serve in the Minnesota Senate.
Hi everyone, I am Sandra Feist. I am the representative in the Minnesota House, and I am honored to be the chief House author of the Keeping Nurses at the Bedside Act along with Senator Murphy.
We are delighted to share that we are heading now into a conference committee to advance this piece of legislation through the last stage of debate in the legislature before we take it back to the floor of both the House and the Senate and into passage. And this is a multiple year labor of love, and we have worked, Representative Feist and I, very, very hard and tirelessly, really, over the last 10 or so days to reach a conclusion around a piece of legislation that embodies what we believe are the most important tenets of this legislation, that give nurses a powerful voice to take care of patients in our hospitals across the state, to do so safely, but to bring their professional judgment and the work that they know best to that care, both in the patient's room and in the execution of plans in the hospitals across the state, so that when nurses are caring for patients, they know that they are doing it to the best of their ability, and they're doing it with the benefit of their professional voices in making the plan. So now they're not just going to be taking care of a patient, but they're also going to be involved in the execution, the development and the execution of staffing in our hospitals, and they have the power to actually get that done. We believe that this is important for a couple of reasons. One, we believe that registered nurses, along with direct care workers, need to have a powerful voice in caring for patients. They have the professional experience to do that work. Their judgment matters. Too often it has been overlooked. And when we pass this into law, their judgment will be embedded in the planning, the execution, and caregiving in our hospitals. We believe that is critically important. The second thing that we understand that is necessary is that the nurses need to make sure that they have the ability to execute that work with a little power beneath it. We want to make sure that nurses not only uphold what is required of them by our license, including when it is time for them to say no to a patient assignment, if in their judgment, and this is current law, if in their judgment, taking on additional patients will put patients' safety and health at risk. That's current law. Nurses are expected to take that step if the patient assignment is too much in such a way that it would put a patient's safety and health at risk. We are also adding, though, because we know that nurses, when they execute this part of their voice, are often threatened. They are sometimes bullied. They have been suspended. So we want to make sure that the law backs them up in doing what they're expected to do to safely care for patients in hospitals across the state of Minnesota. This legislation accomplishes that, and we're going to go into that room when we're done talking with you to begin the process of putting that conference committee together to put the legislation in its final stages so we can pass it through the House and the Senate and make it the law. Thanks.
So I would like to talk, we've talked high level why this is so critically important. I would like to get into the weeds for a bit because that's where I live. And I would like to talk about the process that has gone into constructing this bill. This bill has been around since 2008. Nurses have been coming to the Capitol since 2008 and asking for us to support them, asking them to address this issue that has gotten worse and worse over time. And at the beginning of the year, I was incredibly honored to be able to step into the role of Chief House Author. And it is my nature to dig into those weeds and dig into the details. And we have worked tirelessly with hospital stakeholders over the course of the entire session to make this bill even better and stronger. This bill has basically been co-authored by hospitals in a way that keeps it true to its core and to its mission and to its effectiveness, but also ensures that this is a practical, workable, easily implementable bill. This is a streamlined bill. This is a very thoughtful bill. And I just want to make that really clear. Like, there are message bills sometimes, and then there are bills, and this is a bill. and that is because of all of the amazing nurses who have provided their input and their stories and made it clear what was like the things in this bill that we could not compromise on. and the things where we could find a workable, viable path forward to make sure that this bill really reflected the voices of the experts in the healthcare industry. And so I just wanted to make that really, really clear. This is an awesome bill, and this bill deserves to pass into law, and these nurses deserve our support, and we are so excited to get into that room and to dig into the details and hear their voices and make sure we pass this bill.
All right.
Is it going to include a Mayo carve-out?
The legislation does include a Mayo carve-out. When the Mayo made that demand, the governor agreed. And we don't believe this becomes law without that. It is 16 hospitals in the state. It means 90% of the hospitals will still have the benefit. And let me be really clear about this. The intention of this legislation is to make sure that nurses want to safely practice in our hospitals. They are saying with their words and with their feet that it feels unsafe to practice now and meet the standards of licensure and our own professional standards in caring for patients.
So wait, the carve-out is not just for Mayo, Rochester, Holmes, and Kings and Queens with Mayo, Fairmont, and Mayo, and others?
So the nurses with their feet are leaving, and we want to make sure the nurses are coming back and practicing in our hospitals. So for the 90% of hospitals that will be included in this legislation, they're going to have the benefit of registered nurses choosing them, because they know those hospitals, at 90% of hospitals, nurses are going to have a professional voice in staffing. And for those that decide that they want to care for kings and queens, let me just say that regardless of the hospital, regardless of where in the state, if there is a Minnesotan in a hospital bed, from a nursing perspective, that person is the king or queen of the day. They get the same level of care regardless, and we've worked very hard to make sure that we are setting a high standard that meets our high professional standard, so that wherever, whether it is a small rural hospital, a critical access hospital, a regional center, a major metropolitan hospital, that nurses have a powerful voice in making sure that we can execute our professional obligations and care for patients safely.
So after that ultimatum came out, you all made a commitment that Mayo would not be exempted, and so why is Mayo exempted now?
Because we want this to become law.
And why can't it become law without the exemption? Who won't? Whose fault is it?
So I think it's crystal clear, Max, that the governor has said that he wants to make sure from his perspective, and he's making a judgment from his perspective as the governor, that it is better for Mayo to be carved out of this provision. I don't agree, but I want for the 90% of the hospitals that are going to benefit from this legislation, I want us to proceed.
So is the carve out the amendment language that they have proposed that talked about that their system for staffing was adequate? And I know the representative said it wasn't, it was generic language.
Yes, so the language that Mayo Clinic proposed that would show how excellent they are was actually a list of things that every single hospital is required under law and under their accreditation to do. So we decided that we did not want this bill to reflect a misunderstanding that carve-out was based on an unusual exceptional standard. It was based on politics, and so that is the way the language reads.
So it is different than what they had sent to you as the amendment that they wanted.
Yes, it is not that language.
Will Mayo also be exempted from the incentives like that nurses would get, like tuition reimbursement, or can nurses who work for Mayo still get tuition reimbursement?
We were told that we had to carve Mayo out of the entire bill.
Let me offer my thoughts. Jim Abler from Anoka, and I'm, oh yeah, okay, that's right, in the middle, in front of us. Whoa, oh, the bright lights, oh, stop. Nice one light. Anyway, Jim Abler from Anoka, and I was pleased to be invited to join this conference committee. It's been a very interesting session for inclusion and not, and I'm actually happy that this bill can be brought into a separate place so it can be discussed. And you know, I'm here because of the patients. If you read these signs, it talks about patients. And so, number one, patients need to feel like they're getting the care they need in hospitals and where they go. They pay a lot of money. They pay a lot of insurance premiums, thinking that when they go into the hospital, they're going to be getting adequate care. It seems in many cases, the nurses that are serving them are physically and skill level, or just it's just impossible to serve those individuals. And that's just a problem. That problem was there in the beginning, the problem remains now. And so how do we get after that? In many cases, nurses go to work thinking they're going to go home at 5 o'clock and barbecue, and they're injured and they're in their own hospital for the injuries they sustained, and now they have rehab, and in fact, they're not going to barbecue for several months. That's a problem. And so besides that, the dialogue between management and the nurses sometimes has been very marginal. And that's why I've been at various hospitals on lines carrying signs much like this, because the dialogue needs to happen. And so I am here as a person trying to find the best way to make sure that the nurses are going to be first the patients, and then the staff, and then that can functionally work. I'm eager to be a part of that. I think I'm not sure that the final language is yet written that makes the most sense, but I'm committed to patients, to safe nursing, and to a functional healthcare system which is under stress like it's never seen before. So thank you.
Since you offered to go in the weeds, can I go in the weeds with you on
I'd love
Tuesday?
to go into the weeds.
I'm going to get over here.
You can answer all the weeds questions.
So the way this was drafted, at least 35% of the members of the committees, these hospital committees have to be nurses, and at least 15% have to be other staff members. Well, unless the committee is 20 or 100 people, that by math requires the majority to be nurses and other staff members, whereas hospitals would suddenly be a minority.
So 50% plus 35% plus 15%, isn't that 100%? Yeah, that's
Yeah,
100%.
Yeah, but
Yeah, I can do math.
but if you have 10 people, it has to be at least 15% and at least 35%. The majority, by default, by the law, has to go to the nurses and the other caregivers, which might be a problem for hospitals. That's a big number. That's more than some hospitals have on staff.
I remember we talked about this and decided it does make sense the way it's drafted. But I don't remember why, but I know it.
We'll make
I know
it
it's
work.
amazing. No, I know that we
We will
actually
make it work.
Yeah, and we thought about that, and it does work. I'm not a math person,
Sure.
so yeah, sorry.
I am. I'm a math guy.
You
So
want to
yeah,
answer that?
it'll work.
Yeah.
My other question was about arbitration. Nowhere does it say who gets to pick the arbitrator, which might be a significant step.
Yeah, so we did a couple of things, and today we will be adopting a new language that everyone will have the opportunity to see. But we did a couple of things. So we made sure that the language says that it would be a mutually agreed upon mediator or arbitrator. We also added in a section in collaboration with the Minnesota Hospital Association to create a best practices toolkit with assembled stakeholders from the healthcare sector. And we added to the duties for that toolkit to talk about the process by which a mediator or arbitrator would be selected. Because my understanding is a lot of times what will happen is both parties will select their people, and then those people will select a third person. But we decided it was too clunky to be that prescriptive. But we made sure, there's a lot of this. We provided a lot of clarity throughout the bill, but there are just some of the technical, practical questions that don't need to be in the statute. And so that's why we created that 6-month implementation phase with assembled stakeholders in the Department of Health to create those best practices toolkit, and that absolutely is one of their enumerated duties.
Can I ask a question about pulling it out from the HHS omnibus? Can you explain more why that is? Were you afraid that it was going to get more watered down as negotiations over that bill continue? Could it have been used as a bargaining chip?
So from our perspective, as we wind our way through these final days of the legislature and they continue to do work on health and human services, we wanted to make sure that we took advantage of the last days of this to get this passed. And from our perspective, it was more important that we pull it out and bring it forward on its own than to leave it in the negotiations around the Health and Human Services bill, because we just have a few days left, and this is important for us, it's important for patient safety, it's important for nurses, and we want to get it done.
I can comment on that too. Stand by.
Go ahead.
This powerful mic, bright lights. I'm glad it's a standalone. If anybody's been watching the conference committee on Senate File 2995, they really haven't had to spend a lot of time watching it because there's been nothing in the public whatsoever of any of those topics. And if there's a flashpoint topic that really needs the public discussion with all the give and take, all the questions that are being asked here, many more to come, I think it's a great idea, and I'm just happy to be a part of that.
Vote for it. You may not have been able to vote for it if it were the HHS bill.
Well, I haven't seen the final product yet, but we'll have to wait and see. So.
No, for clarity's sake, the funding for this proposal will be carried in the Health and Human Services bill, just so everybody knows. And of course, we're going to get that across the line. It's important, but we wanted to make sure that the work that so many have done, and there are a lot of people in this space and many others who have done tremendous work to bring this bill to this place. I know that there are people who have worked with us who don't yet support the bill, and I understand and appreciate that as well. But it is really the result of a lot of effort. I want to give a lot of credit to Representative Sandra Feist for all of the detailed work that she has done to make sure that this is the strongest bill that we could pass. And I want to thank my colleagues, Senator Bolden, who's also a registered nurse, Jim Abler, who is a provider, a chiropractor, my Senate colleagues who have been supportive of this all the way, which we really are grateful. Representative Kayla Berg, who's a co-author on the bill, and Rep. Greg Davids, though I'm not sure where he's, he might be inside. Yep, this is it's an important moment. It's taken us a long time to get here, and I'm really grateful for everybody's help.
I just have one final thought, and so I think we have to go in pretty quick, but people ask, well, who likes this, who likes that, is that fair or not? If you think anything ever comes out at the end of the process here identical as it went, especially when it has people that are on all sides of it, honorable compromise, in my view, is the way this bill goes forward to actually work. And so that's my commitment. I know it's the commitment of the nurses I've talked to and talking to the hospitals as well. There's a lot of conversation going on, really constructive, and looking forward to that.
Can you say anything?
Could I just make one follow-up point?
Absolutely.
And I just want to be clear that this bill reflects a ton of compromise. And I call it compromise, but it is also just the process of drafting a good piece of complex legislation is hearing all voices and weaving those voices into the bill. And so there were a lot of things that this bill started out with that it no longer has. And a lot of that was true, meaningful, significant compromise. And I just want to make that clear too.
Thank you so much. As Senator Murphy said, Representative Kayla Berg, I have 2 decades in the labor movement. I want to be very clear that this is a labor issue. And as legislators, we don't just show up on the picket line for a photo op. We don't just accept your endorsement and your door knockers and volunteers. It is incumbent upon us to stand in our integrity. And when this comes to us for legislation, that is when we care for those that care for us. Thank you.
Right. Thank you.